Before watching the video, don't forget to subscribe to our channel by clicking the subscribe button below and clicking the bell icon to be notified whenever we publish a new video. Gluten intolerance is an increasing reality that affects more and more people. The appearance of small balls that resemble acne on the arms are one of the most common symptoms of gluten intolerance. Celiac disease is an autoimmune disease, and one of the symptoms of this disease is intolerance to foods that contain gluten. Gluten is a protein that's present in wheat, oats, barley, and rye. Celiac disease is the result of a genetic condition and can arise at any point in life. When people have this disease, they suffer from an immune response that leads to the production of antibodies that affect the digestive system and the whole body in general when gluten is ingested. But does that mean that gluten intolerance and the celiac disease are the same thing? The answer is no. A person may have an intolerance to gluten, more or less severe, and not suffer from celiac disease. In these situations, the issue isn't a genetic one, but rather related to other factors that still aren't yet known. However, the greatest difficulty of this condition is its diagnosis. Because the symptoms are common to other pathologies and arise slowly, it's difficult to make an initial diagnosis. One of the main symptoms is the appearance of the small balls on the arms that we mentioned earlier. It's a condition called keratosis pilaris, which occurs due to the accumulation of keratin on the back of the arm, a lack of vitamin A, and fatty acids. These blackheads are similar to goosebumps, and it's important to know how to identify them so they can be diagnosed. Since intolerance to gluten can damage the walls of the intestines and prevent the absorption of fat, the body will become deficient in these areas, no matter how good a person's diet is. But take note, it's nothing to be alarmed about because the existence of blackheads isn't enough to make a correct diagnosis. It's necessary to know the other symptoms in order to determine if there's a gluten intolerance or not. Here is a list of the most common symptoms among those that are known and related to the intolerance of this protein. Recurrent digestive disorders. Fatigue or exhaustion, especially after eating foods containing gluten. Hormonal irregularities. In women, it's easier to confirm if they suffer from irregular or painful menstrual cycles, infertility, or miscarriages. Migraines. These are almost always related to digestive difficulties. Inflammation or pain in the joints. Anxiety, depression, or mood swings. The clinical family history is also decisive for our propensity to develop this intolerance. The existence of autoimmune diseases in the family increases the likelihood that we will suffer from this intolerance. If you experience several of the symptoms mentioned above, we recommend you visit a doctor and speak to him about digestive tests to help diagnose this disorder. The exams are not infallible. In some cases, they may be negative even though the patient suffers from a gluten intolerance, but to a slightly lesser degree. You can try to eliminate the amount of gluten you consume for a month and check to see if the symptoms stay or disappear. This is another method widely used to diagnose this condition. A month is the minimum period for our body to eliminate the toxins that the undigested gluten leaves present in our system, and thus test if it causes us problems. It's surprising how much food doesn't contain gluten. When for some reason you cannot prepare meals at home and have to eat out, it's important to ask if the foods have flour in their composition so as not to consume gluten without knowing it. Only then will it be possible to maintain a totally gluten-free diet in order to see if there's an improvement or not. If you liked the video, give it a thumbs up and share it with your friends. For more recipes and tips, subscribe to the channel.